There are two kinds of range of motion evaluation: passive and active. Passive is when the examiner moves the tested person's limbs to see the range. Active is when the examined person moves their limbs themselves. Here is a demonstration of shoulder flexion. First, passive, when the examiner moves their arm into 180 degrees flexion. Then active, when the tested person moves their arm herself into 180 degrees. A positive limited range of motion test for shoulder flexion is any flexion less than 180 degrees. This is showing shoulder hyperextension. Normal is 60 degrees and the test is shown in active and passive range of motion. A positive test for limited shoulder hyperextension is any extension less than 60 degrees. Here is a demonstration of shoulder abduction. Normal abduction is 180 degrees, shown both in passive and active. A positive test for limited shoulder abduction is any abduction less than 180 degrees. Here is shoulder adduction. Normal shoulder adduction should be 75 degrees. A positive test for a limited shoulder adduction is any adduction less than 75 degrees. This here is showing shoulder horizontal abduction, and normal range of motion is 50 degrees. A positive test for limited horizontal shoulder abduction is any horizontal abduction less than 50 degrees. Here's a demonstration of horizontal adduction. Normal shoulder horizontal adduction should be 130 degrees. A positive test for limited shoulder horizontal adduction is any horizontal adduction less than 130 degrees. Illustration of lateral rotation of the shoulder joint. Normal lateral rotation of the shoulder joint is 90 degrees, and the hand and forearm should be able to rest on the surface the person is laying on for a full 90 degrees. A positive test for limited lateral rotation of the shoulder is any time the lateral rotation is less than 90 degrees and the person being tested is unable to put their hand and forearm down on the surface they're laying on. Here is shoulder medial rotation illustrated, and a normal medial rotation of the shoulder is 70 degrees with about 20 degrees off the table for the forearm. A positive test for a limited medial rotation of the shoulder is any rotation less than 70 degrees. If the person has a limitation, they might try to compensate by elevating the shoulder to increase the medial rotation. Caution must be taken to make sure the person being tested keep their shoulder on the surface they're laying on at the same time as they medially rotate the shoulder. Go. Muscle length test for pectoralis major. The person being tested is laying on their back with their knees bent. The arm is abducted to 110 degrees. The entire shoulder and arm should be able to lay down on the surface that the person is laying on. A positive pectoralis major test is when the arm is coming off the surface they're laying on. This is a muscle length test for the subscapularis. The tested person should be able to reach their mouth with their fingers. A positive subscapularis test is any time the tested person cannot wrap around their head and reach their mouth with their fingers. Here is shown a muscle length testing for the Latissimus dorsi and Teres major. The person should be able to have their back flat and let their entire arm come down to touch the surface they're laying on. A positive Latissimus dorsi Teres major test is when the tested person cannot lay down a straight arm to touch the surface they're laying on. They might try to compensate or cheat by arching the lower back. The back should be flat on the surface. This test is called a torso twist. Normal range of motion. The tested person should be able to lay their arm and hand to touch the surface they're laying on. A positive torso twist test is when the tested person is unable to put the shoulder and arm to lay on the surface they're laying on, or when they try to straighten out the back by laying flat on their back. This test is a test for pectoralis minor. A positive test is when the posterior part of the shoulder is not touching the surface the person is laying on. This is called a back rub test. The person is supposed to be able to reach across their back. A positive back rub test is when the tested person is unable to reach across the lower back with their hand. This test is called a half Nelson muscle length test. The hand is placed on the lumbar spine and the elbow should be able to relax and touch the surface the tested person is laying on. Here is shown a positive test on the right where the elbow cannot drop down to the surface by itself. This is called a posterior capsule test. The person should be able to have a 90 degrees abduction and 90 degrees flexion in the elbow, and the elbow should be able to touch the surface they're laying on. This test is called hand to scapula. First showing a negative test, then a positive test. Biceps extension test. The person should be able to extend the arm in 60 degrees and keep the elbow fully extended. A positive test is when the elbow is bent or the arm cannot extend as far as if the elbow is bent. Elbow extension test, normal range of motion is 0 degrees. A positive elbow extension test is whenever the tested person cannot fully extend their elbow to a straight arm in 0 degrees. An elbow flexion test, normal range of motion is 150 degrees. A positive elbow flexion test is whenever the tested person cannot flex and bend their elbow 150 degrees. Forearm Supination test, normal range is 80 to 90 degrees. A positive range of motion test for supination would be any range of motion that is less than 80 degrees of supination. And forearm pronation test is shown, normal range of motion is 80 to 90 degrees. A positive test for limited range of motion of forearm pronation would be any pronation less than 80 degrees. Wrist extension. Normal wrist extension should be 70 degrees. A positive range of motion test for limited wrist extension is any wrist extension less than 70 degrees. Normal wrist flexion is 80 degrees. A positive test for limited wrist flexion is any flexion less than 80 degrees. Normal wrist radial deviation is 20 degrees. Any radial deviation less than 20 degrees is a positive test for limited radial deviation. Normal ulnar deviation is 30 degrees. Any range less than 30 degrees is a positive test for limited ulnar deviation.